Ladies and gentlemen, I want to give you a bit of a sense of what we do, and to talk about was actually a couple of the great projects we've worked on. This is a device that basically helps people walk again. Some of us, almost all of us know someone's had a stroke, or potentially they've had sort of a back injury, something similar, perhaps in the military, and they can't walk. This is the only robotic exoskeleton that people can come along in their wheelchair, pull themselves up into the robotic exoskeleton, and it walks for them, but they don't need to use crutches. All the other products have to use crutches. And why is that so important? It's because if you are walking and at the same time doing something else with your hands, throwing a ball, reading a book, etc., improves the neuroplasticity of the brain, and therefore helps you build some of those links in the nervous system again, and potentially helps you walk again. Now they came to us because of our expertise in batteries, in robotics, in industrial design. The device I got, and this is actually the original device we're looking at improving, is very heavy. It's actually a lot of steel. I want to reduce the weight. It uses a lot of motors and it has a lot of batteries in there as well too. So they've come to us to say, look, Hydrix, you've got the expertise in mechanical engineering. Can we replace the metal with other things, plastics that are lighter? Can we drop the power usage of the device? Can we make it more comfortable? Can we adjust it to sort of suit walking up inclines and so on? So there's some of the work we're doing on this particular device, and I'm really delighted that Hydrix are doing this, because it's about helping improve those 1 billion lives, improving the quality of life of people who can't walk and potentially can now walk. Particularly being used in rehabilitation for stroke victims, as I said, and people who've actually got other spinal cord injuries. So we're working on that one there. You can see a couple of renderings on the wall, pictures there of what it might look like, and you can see it's looking quite more attractive, sort of what some industrial designers sort of see. Gavin, our chairman, mentioned before about the AngelMed product. So AngelMed is the world's first FDA-approved implantable heart attack detect system. So this is actually the size of a pacemaker, and this is a standard pacemaker can. And what's unique about this is that if you've had a heart attack, one of the biggest issues is you live in fear of another heart attack. You've got increased chance of having another heart attack. If you've got unstable angina, the same thing goes. If you've got diabetes, you're at high risk of a heart attack. And so people live a life in fear. At the moment, the only way to know if you're having another heart attack is you've got feelings in your chest, if you're at home. And as you know, men particularly said, oh, well, I've eaten too much, or I've picked up a grandkid or something similar, it'll go away. Often it's a heart attack and it doesn't go away. So this implantable device just goes underneath the collarbone there. And what it does is it looks at your heartbeat, your ECG, your typical ECG signal, and it has artificial intelligence built in, and it learns. It learns about your heart and your activity from when you wake up to when you go to bed at night, everything in between. And then after 14 days or thereabouts of learning, it then can start to detect whether or not your heart is actually acting abnormally. In particular, what's called the ST segment, so after the high bit of the ECG is a little bit there, if that's elevated, it quickly detects it, and it does a couple of things. It either buzzes under your under your skin there, so you can feel it, and it has a wirelessly connected EXD device, and that device also flashes and makes an audible alarm. So you've got a physical alarm, an audible alarm, and you've got a flashing light. And tests, a survey in the US, clinical trials in the US of 900 patients showed that with just symptoms alone, the typical patient took about 12.5 hours to get to hospital. With the AngelMed, combined with the AngelMed device, alarming in the chest and elsewhere, the average patient got to hospital in 1.5 hours. And of course, it's about speed to hospital. The sooner you get to hospital, the sooner you can have treatment, and reduce the chance of permanent damage in your heart, or worst case sort of death. So this device, as we signed a multi-million-dollar contract, as Gavin said, and we're so impressed by it, we've taken on the distribution rights for it across Australia and Asia as well. It's a portable X-ray machine. Now, some years ago, the client came to us and they said they had some patents they'd acquired in X-ray technology, nanotechnology, in fact, which is microscale technology, and they had a couple of pictures and a bit of market research, and they had this idea of actually trying to create a low-cost, low-weight X-ray machine. So we brought together the best guys we had in thermal engineering, because these things get hot, the best guys in battery engineering, the best industrial designers to make it look good and be easy to use, the best software guys, the best electronics guys, and brought them together as a team. And in 2 years, we turned an idea and a picture into a functional prototype that's being displayed at shows. Now, the capability that Hydrix has in that domain is unsurpassed. Under one roof, we had all the expertise, all those disciplines to bring together to actually sort of build this X-ray machine. Typical portable X-ray machines, Siemens and other brands, Shimadzu and so on, are 400 or 500 kilograms. They're very, very heavy. and they take a lot of power. They need to be charged for many, many hours, and they're large. So what have we got? We've got an X-ray machine that instead of being 400 kilograms is under 100 kilos. Which two important things. First of all, if you're a nurse, maybe a female nurse, 49 kilogram nurse, imagine pushing around a couple of 100 kilo machine. This one under 100 kilos can be done, and it's got little mechanism here where you can turn it on and off and actually unlock the wheels, make it even easier to push as well too. Secondly, lifts in Europe are rated at 400 kilograms, so many competitive X-ray machines can't go in the lifts. They can't be taken upstairs, and often there's patient wards upstairs, so you have to take that patient downstairs. At under 100 kilograms, this one of course can be taken in lifts upstairs. There's also low power. It's also wirelessly connected to the hospital information system as well too, so it's actually a smart X-ray machine. And it's using nanotechnology, which is a bit of a buzzword, but it's some really advanced technology that will actually help the client not only improve, but actually got a couple of patents around that X-ray technology, the first couple of patents in quite a while. Again, all that expertise under one roof, and that's why they came to us. They're now looking at alternative versions for the Defence Forces and other areas, and we're working with them as well too. So really quite impressive, and it's now been sold, I think, out of the US right around the world. Another device I want to talk about is this device. Felix is the name of the device. It's a funny old name, but the company's called Memphasis. They're publicly listed. MEM is their code. They had a technology that actually had a special membrane that actually sought out sperm, good sperm from damaged sperm, originally looking at racehorses. They asked us to repurpose that for humans to help with IVF. So damaged sperm obviously has less chance of fertilising an egg. So this device actually helps with the IVF process and actually improves the quality of the sperm for that sort of artificial insemination. So we designed the entire device, including the cartridges as well too. I think they're going to clinical trials very shortly, I think. Is that correct, Michael? We expect to see that, they expect to see that in the market next year, but we're very proud of that because, again, it's about improving lives, helping people have children. I think is a very important part of being human. This is just a very small selection of the probably 250 to 300 projects and products Hydrix has done over the last sort of 10 to 15 years. We don't just work across medtech, although medtech is represented here. We work in the defence and aerospace sector, and we're working in the consumer and industrial space. Our client base from the US, from Europe, from the UK, and across Australia, as you'd expect as well too. So we're quite a globally diversified company.